Community medicine is that branch of medicine which deals with the study of provision of first preventive, second promotive, third curative, fourth rehabilitative, and fifth evaluative services to the community at large through an organized, comprehensive health care delivery system. The term medicine encompasses all the activities which are directed towards enriching the health of the beings on this planet, humans and other species as well, with particular focus on the human well-being. The WHO defining of health, which states that health is a state of total physical, mental, and social well-being, and not merely the absence of disease or infirmity, is a fair representation of the multi-dimensional aspects of the state that we refer to as health. This leads us to the definite understanding that medicine is not merely the art and science of healing alone, which concerns itself predominantly with the physical aspect and a little bit with the mental aspect of humans. Though incompletely in the past, all the focus in terms of budget allocation and infrastructure development was primarily directed at the sick population in the community, which accounted for a maximum of 3 to 5% of the total population. This left the apparently healthy group of nearly 95 to 70 sorry 97% people unattended once. Once the awareness of this aspect of the policy came into being, there was a need to shift the focus from disease to health. This heralded the birth of community medicine. The evolved understanding the treatment of patients without due consideration about the hygiene and the sanitary aspects is bound to be unsuccessful. Taking into consideration the hygiene and the sanitary aspect alone without reference to the patient's living, social, and working economic conditions is again an incomplete and partial solution to the complete return of health. For example, an unemployed patient of the lower strata of society with gastroenteritis living in a contaminated environment and having unhygienic habits will never get a lasting cure if he is just seen as a case of diarrhea in a clinic setting alone. The hygiene, sanitation, and the social and economic aspects are so interlinked that they form very essential factors in the way of causation of the disease in question. For a medical practice to be wholesome, the practitioner must be a good clinician, like with skills in diagnosis and treatment, abreast of the knowledge regarding the role of hygiene, sanitation, and social and economic factors in the various stages of disease evolution in the community. In this kind of practice of medicine, the social diagnosis completes the disease diagnosis. The social treatment supplements pharmacotherapy. The social hygiene fortifies the individual hygiene. The concept of prevention is often misconstrued even amongst the medical fraternity as an action that happens only before the disease onset, but in the true sense, it encompasses the whole possible range of all the activities which are directed towards health care home, from primordial prevention even before the risk factors for the disease even enter into a community. Primary prevention, immunization activities, etc. Third, secondary prevention, early diagnosis and treatment. Two, fourth, tertiary prevention, disability limitation and rehabilitation. Hence, social and preventive medicine is no part apart from the short-term clinical medicine. It is an inseparable part, and in fact an extension of clinical medicine from its constant hospital clinic set up into the community, which is the multi-faceted ground on which the pollens of disease flower and spread. Simply chopping out the revealed portion of the weed will not solve the problem. What is needed is an approach to uproot it from its root, to study and nurture the soil and to correct the imbalances which are detected for. It is the soil which is the very source of life and health. The soil that we refer to as the society, living beings and nature. Social and preventive medicine is thus a tool of enhanced responsibility that meets the needs of an individual from home to home. That is laid on the shoulders of the physician so as to deliver true health to the community. The same community to which the physician belongs to, and the same community which has laid its faith upon making the physician what he is. The mission of community medicine teaching is to contribute to the development of a well-rounded holistic medicine professional who will demonstrate knowledge and competence with compassion in dealing with primary health care, desire for lifelong learning, evidence-based practice, interdisciplinary team work, and professional and ethical behavior in practice in order to improve and sustain the health of the population. Community medicine teaching has a major role in achieving the main goal of graduate medical education in India. The guidelines and regulations of CCH also emphasize to include community medicine in all the two phases, third and fourth of BHMS curriculum and also during internship. Objective of teaching community medicine to BHMS students can be broadly grouped into the following areas: to team prepare them to function as community and first level physicians in accordance with the institutional goals, to make the students aware of environmental, social, financial, personal, occupational issues of the patient, and to in, inculcate in the students the habit of considering the above aspects while rendering patient care, to teach them practice techniques of prevention at individual, national and international level for various health issues. The orient the students with Indian health system, national health programs and policies and international health policies and agencies, to teach research principles and methodologies so as to create scientific attitude.